Hi, this is Mary Mackenburg-Mohn, and I am going to show you how to use your clinical Constellation. And I don't have an external camera for my laptop, so I am recording this with my phone, and we'll see how this works out. So by now you should have gotten the email from Sawati with information about about your individual code number to download your software. The first thing that you need to do is to download the software from Skyscape to your mobile device. It can be your phone or your iPad. This is my iPad, and I use my iPad because it's larger and easier for me to see. So the icon for Skyscape is right here, and you should hopefully have done that by now. The first time you open your Skyscape, it's going to ask you to create an account and to enter the information that you got in the email from Sawati. I am going to assume that you have done that. So I'm going to open Skyscape and show you what it looks like. When you open Skyscape, you get a screen that looks like this. This is the home screen, and this has an icon for every one of the medical references you have. The clinical Constellation you received is an integrated group of medical references. And for yours will not look exactly like mine because I have different references on mine. You will have a book called the 5MCC, which stands for 5-Minute Clinical Consult. You will have a drug reference. You have a lab guide. You have a differential diagnoses reference. And you have a reference related to clinical evidence and evidence-based practice. You can add more references to your Skyscape clinical Constellation by going to their website. For some of you, we will require a few things later on, others not. So what Skyscape does is enables you to type in a problem, and it will identify all of the various resources you have that deal with the problem. So I'm going to start by entering a problem, and I'm going to put in the Smart Search tool, pneumonia, N-M-E-M-O-N-I-A, and hit return and search. Skyscape is now searching. Oh, I must have spelled it wrong because I'm not getting any matches. Oh yeah, let's spell it correctly. That will help. So P-N-E-U-M-O-N-I-A, search. And now it searches and it will tell you all of the various books that have information related to pneumonia. 5-Minute Clinical Consult. I'm not sure if you have Archimedes, evidence-based diagnoses, Harrison's, ICD-Ms. So again, I have different things than you do, but you can scroll through the list and find out which references have information related to pneumonia. Now the 5-Minute Clinical Consult, 5MCC, is an excellent tool. It's the one I always start with. And when you pick it, it will give you another list. The topics related to pneumonia are quite a few. There's all kinds of different pneumonias. And just for the sake of the demonstration, I'm going to pick bacterial pneumonia. And it takes me to information related to bacterial pneumonia. The first section of each related to each disease are basics. What it is, the epidemiology, the description, general prevention, pathophysiology, etiology, and associated conditions. If you scroll through, you'll get to the next section, which is diagnoses. We'll talk about signs and symptoms, diagnostic tests and interpretations, what you should order in terms of lab and x-ray, how you might interpret those, and it will also give you a list of pertinent differential diagnoses. The next section is treatment. It will give you information about medication treatments, it'll give you information about additional treatments, and then any kind of inpatient considerations if you're dealing with patients in the hospital. The final section is information related to ongoing care. And then there's some miscellaneous stuff related to coding and documentation. So let's go back up to treatment because I want to show you about the drugs. Okay, so treatment, medications. If you pick medications, it will talk about the various kinds of medications that could be used in treatment of pneumonia. It's an overview. What if I want to look at my drug book? I'm going to look down below and see three little icons, one called Home, one called Links, and one called History. Home will take you back to the very beginning. We don't want to take that one. Pick Links. It will bring you back to your list of reference books that you have available, and you could pick your drug book. I'm going to pick drugs, and now I go to my drug book, and it lists all of the possible medications I might think about using in the care of a patient with pneumonia. Let's say I want to do a little bit more reading about the use of Zithromax, so I'm going to pick that. And then I have the option of learning about systemic Zithromax or ophthalmics. I don't want ophthalmic. I'm going to pick systemic Zithromax. And it talks about Zithromax, how to use it, how to dose it, how to prescribe it, how it works, the pharmacokinetics, the pharmacodynamics, a little bit about costs. This is kind of handy. These are generic. These are average national costs. So if you have a patient that doesn't have insurance, this kind of gives you an idea if you're picking something cheap or not for them. It will give you information about routes and dosing, contraindications, how to dose it in specific situations, all kinds of information. All right, that's my drugs. I'm going to go back to my links. And let's say I want to know more about what the the CDC, Centers for Disease Control and Prevention, say about it. I can pick that. Oh, it didn't find any related information. Oh, because I'm on Zithromax. If I went back to looking at pneumonia and picked my link of CDC, it will take me, oh, I'm lying. It should take me out to the website. I don't know why it isn't. Let's say I want to see something related to outlines in clinical medicine. This will give me evidence-based studies on various things, different kinds of pneumonias, different medications, things like that. When I'm done, you pick the done up at the top left, or excuse me, top right, and it will take me back one screen. If I get lost, I can use the history icon, and it will show me all the different places that I've been. I looked at bacterial pneumonia, I looked at Zithromax, I looked at pneumonia, I looked at drug safety, so it kind of goes down the list. Okay, let's try another one. I'm back to the main. I'm going to go back to home. Home key down here. And I'm back out to my home page where I have my references. And I'm going to do a different search. Now I'm going to search for chest pain. Oops, did I spell it? Yeah, I spelled it right. Search. And it's starting to search through all of the various references to find all of the ways it matches with chest pain. I, again, like to start with my 5-minute clinical consult, and I get two choices. I get chest pain acute coronary syndrome, algorithm for care, or I get myocardial infarction. Let's go to myocardial infarction. When I pick this, it talks about all of the different things I want to know about MI. Starts with the basics, goes on to the diagnoses, goes on to the treatment, goes on to the ongoing care, talks a little bit about who needs to be hospitalized, who doesn't, what the prognosis and complications might be. There's miscellaneous information related to coding, and then there's references down here as well. If I want to look at, let's say the medications again. I'm going to pick pick medications. Oops. Yeah, I did get medications. So this talks about first-line medications, second-line medications, additional treatments. And I have the option of reading here for general medication information, or I can go to links and, oops, I hit history. Sorry about that. I'm trying to do this watching through my phone. So I'm going to hit links. And again, it pulls up all of the different texts that have information about the drugs. So I pick my drug book, and it goes through all of the typical medications related to caring for a patient with chest pain. Things you might want to think about prescribing, things you might want to give imminently. Now with something like chest pain, I believe you also have the ACLS guidelines. Oops, got to go back to chest pain. Pick my link, go to Rapid ACLS. Ooh. I want to find the algorithms for caring for a patient with chest pain. There we go. All of the ACLS guidelines for caring for patients with something like chest pain or bradycardia or tachycardia are integrated in here too. So you have all of your ACLS guidelines. For those of you who have taken ACLS, you'll recognize these. The BLS guidelines are not included in Skyscape because it's assumed that you know those guidelines pretty well. Okay, so that's a quick overview. A couple other things that Skyscape does. If you go back to home and look at the bottom, you're going to see a cart, or a store, it says. You can go to the Skyscape store and add books, as I mentioned. You're also going to see medical alerts, or med alerts. If you touch that, this is integrated with journals and other publications to publish medical alerts or drug alerts. So, for example, for those of you who might have saw this in the press, last week there was an alert related to Zithromax associated with potentially fatal heart rhythm in high-risk patients. All of that information is included here. The date it was released, the issue, the background, the recommendation, and then it gives you links directly to more information. You can look at the MedWatch report, you can see more information about Zithromax, you can see the specific safety announcement that was released, any information for patients or for healthcare providers. So it's up to date. Sometimes you get a lot of these that you're not interested in, and every now and then, like last week, you get one that's pretty important for you to understand. The last thing at the bottom, when you go back to home, is settings. And when you have the little red number, just like on your other applications, it tells you that you have some apps that need updating. So you can take care of that. So this is your clinical Constellation. I hope that you find it to be very helpful in your clinical experiences. And if you need more help using it, I would be happy to give you a hand. Just let me know. Drop me an email and we can set up a time to work through this together. Good luck. Hope you find it helpful.